Good afternoon. I am Dr. Kishore Panda, Associate Consultant, Apollo Hospital, Bhubaneswar, in the Department of Orthopedic. Today, in this our Facebook live session, we have Dr. Devavrat Padi, who is a Senior Consultant in Apollo Hospital, Bhubaneswar, who is heading the department and is one of the leading joint replacement surgeon in Odisha. He is the founder, secretary of the Odisha Arthroplasty Association, and currently he is executive member of the Indian Arthroplasty Association. Welcome, sir. So today he will be discussing about one of the emerging topic, that is joint preservation surgery in the current scenario and its advantage over the joint replacement surgery. So Dr. Padi, please tell us what is a joint replacement surgery?
A joint replacement surgery is a surgery in which the joint is replaced. That means we have joint like a knee joint or hip joint. We have different joints in our body which have a layer of cartilage. All the joints like this knee joint, this one has a cartilage on it. So this cartilage usually gets damaged due to arthritis or due to trauma or due to infection. And when it gets damaged and to a extent that it is the patient is clinically having pain and deformity, then we go for joint replacement surgery when the cartilage is changed to a artificial joint. So that is joint replacement surgery.
So we know joint replacement surgery is a very successful surgery, but still patients are afraid of joint replacement as they hear from surgeons. So
joint replacement surgery, actually people whenever they think of a joint replacement surgery, they become very afraid of that surgery because of many factors which are prevalent in our society and in our medical system, and the amount of advancement which has been done in joint replacement surgery has also been changing every day. So major problems which the patients are afraid of, because it is a major surgery. So whenever the patient is old or with comorbid factors, they become afraid of any complications related to their comorbid symptoms. It takes at least 1 to 2 months for the patient to become normalized post surgery. So that is that they hear from their peer group, and they think that it is a long post-op care is needed, and patient may take little longer time to become normalized. So they become afraid of that. And after that, they are not advised any sports activity or high energy activities like mountaineering, the running, all these things they cannot do. So patients who were active before, they always think that after joint replacement I may not be active as such. And also in our scenario in this country where insurance sector has not penetrated much into the society, the cost is a factor, and high cost involved in the joint replacement surgery is also a major factor. And other than that, in many small centers also joint replacement is done, where complications is a common phenomenon. And when these complications go to the society, a normal patient who is a candidate for joint replacement gets frightened of going for a joint replacement surgery. So these are the major concerns for a patient who opts for a joint replacement, or he has been advised a joint replacement by a surgeon.
okay. So when you as a surgeon recommend your patient for doing joint replacement?
See, patients come to you at different stages of their disease. They will have mild pain, severe pain, and pain which is relieving and then again emerging. So these type of stages are there in all arthritic conditions where the joint surface is damaged. So as a doctor, we have to decide what is the stage in which the patient is, and when is the time when we should go for a joint replacement surgery. For me as a clinician and as a joint replacement surgeon, whenever the patient has come regularly with failure of joint preservation or the non-surgical methods, then we go for a joint replacement surgery. But sometimes patients come directly with gross deformity and pain, and they are having a lot of problem in their day-to-day activities. Even they are not able to walk unaided for 100 meters of distance. In those cases, when they come for the first time also, they are advised joint replacement by me, because in those cases the joint preservation sometimes may fail. So we have to opt for joint replacement surgery in those cases. But those are very less number of individuals. When the patients come early in their with their symptoms, we can plan other procedures, other non-surgical methods before going for a joint replacement surgery.
So, in the recent past, the concept of joint preservation is emerging. So, please elaborate few with the concept of joint preservation.
Because the joint, first I will tell why joint preservation method has come. Because joint replacement is not the final answer. Joint replacement is in vogue for the last 40 years. 40 years surgeons are doing joint replacement. There has been advancement in the technique, advancement in the material, and advancement in the post of care and minimizing the pain, post of pain. All these are there. But even then the patients are not satisfied. All the patients are not 100% satisfied. So the concept of joint preservation has emerged with the advent of stem cell therapy and newer methods of investigation and therapies. Joint preservation concept has come, in which the damaged portion are regenerated, or can be the damage can further be prevented by different methods, which has been recently for the last one to 1.5 decades. These procedures are being in vogue, and they are being developed much in the recent past. So there are different methods of joint preservation surgeries which are used these days, depending on the stage with which the patient comes, and depending on the type of joint damage which the patient has come.
So, can you elaborate few methods, surgical, non-surgical, or any methods that are gaining momentum in recent times?
So the different joint preservation techniques, we can tell that they can be non-surgical or surgical. So non-surgical means by medicines, or by physical therapy, or by injections. Surgical methods are there, which are different types, like cartilage chondrocyte implantation, or a Oates technique, that is osteochondral allograft graft transfer of the transfer system, which is being used for cartilage defects. So these are the few methods which are there, by which joint preservation can be done in the initial phases of the patient symptoms.
How do you see this newer material like hyaluronic acid injection, XL membrane? Are they helpful, or what is your opinion in that?
So when you talk of medical therapy, there are different medicines which are recently being used. Age old, it has been chondroitin sulfate, glucosamine, which are being used for at least 1 to 1.5 decades now. But recently other materials like egg cell membrane, collagen peptide, different types of collagen peptides are being used by different pharma companies, which can be given initially in the initial phase. That means when there is mild symptoms, it can be used by the patients with initial complaint of knee pain or hip pain, or even there is sign of arthritis. When we do a MRI scan and see that there are signs of knee joint damage, then we can go for this treatment if it has not been tried before. There are many such drugs in Ayurvedic medicines also, which are being used as a pharma company because they are plant products which has been used. But these things, these have got limited response. Means in initial stages they may have good response, but later on these things become maybe unresponsive to these patients. But these medicines should be associated with physiotherapy, different types of physical therapy which has been advocated by the doctor and can be taken up by a physiotherapy, trained physiotherapy. You can visit a trained physiotherapy after the advice of the doctor to add with this medical therapy. The physiotherapy can help to alleviate your symptoms.
When should a patient should know that he will opt for a knee preservation surgery, or when a surgeon advise a patient to go for a knee preservation surgery? Who are those candidates actually?
So whenever we tell about joint preservation surgeries or procedures, then we can talk of 2-3 things. One is a cartilage regeneration therapy. What is a cartilage regeneration therapy is a broader term. So cartilage regeneration therapy can include a stem cell therapy, which includes the PRP injection or BMAC injection. If we consider injection as a surgical procedure, then this can be included as a surgical procedure. But these are only injection therapies. So apart from that, previously we were using hyaluronic acid and viscosupplementation also. So different surgical procedures which I had told, these procedures can only be done whenever there is a failure of this medical and physical therapy. So initially when a patient comes to you and he has not taken any medical therapy or physical therapy before, then better we should go for medical and physical therapy initially, and if there is failure, then we can go for procedures, joint preservation procedures, starting from injection to different procedures. And these procedures are keyhole surgeries, very small incision surgeries, so very early recovery. So these are small, very modern keyhole and arthroscopic surgeries. So these surgeries are only advised whenever the patient has failed with the different medical therapy. Sometimes they may be advised in the first go whenever there is a traumatic history of cartilage damage. You can see here this blue color thing is the cartilage, which is the surface of the joint. So this cartilage is damaged whenever there is a trauma. So whenever there is trauma, there may be a small area of cartilage damage. So in this and the other part of the cartilage is totally pristine, that means there is no damage. So it is not arthritic. Say a young guy, say 30-year-old guy who has a history of trauma and there is a joint damage and there is a cartilage defect in the joint. So in those cases we can straightforward go for joint preservation surgery without trying and wasting time in medical therapy and physiotherapy. So these are the patients where conditions in which we can go ahead with the joint preservation surgery.
So you told about this recent treatment like PRP, BMAC. So can you say few words for the sake of our viewers? What is actually the PRP is? How is it prepared, and cost, whether it is cost and their side effect like that, so that they can get a better view on this PRP.
So as you know, nowadays stem cell therapy has become a modern type of treatment in all medical science, all medical subjects. So joint pain, orthopedics has not been away from stem cell therapy. So this PRP, which is platelet rich plasma, and BMAC, which is bone marrow aspirate concentrate, these two are this part of the stem cell. What is stem cells? Stem cells are actually mesenchymal cells. In adults, some of these cells in our body are mesenchymal cells which can differentiate into other cells if they get a proper environment for their growth. So when we take these cells and put in an area where there is a damage, then they get the signal that they have to grow as a similar type of cell, and they may help in regeneration. So in PRP what happens, it is platelet rich plasma. So there is a special machine for that, in which the patient's own blood is taken and it is centrifuged by a specific speed and by the specific instrument to get platelet rich plasma, and this platelet rich plasma is full of mesenchymal cells, and when it is introduced by a simple injection into the knee joint or any joint per se, whenever there is pain in the elbow joint or whenever there is pain in the heel, this can be used as a stem cell therapy. So platelet rich plasma is full of mesenchymal cells which help in regeneration of similar kind of cells. Say if we inject into the knee joint, then it will make a layer on the cartilage, and it will get a signal to grow as cartilage cells. So it will help in some amount of regeneration of the cartilage, and if it is in the very early stage of damage. When there is a lot of damage, it can happen that PRP may not work. So the amount of damage and the amount of research has not gone so far that when there is a gross damage, it can cause regeneration, good regeneration. But there are different other methods which can go ahead with a little more amount of damage. One of them is the BMAC. So BMAC is also similar type of process. We take bone marrow. So bone marrow is usually taken from the ilia crest, that is from the waist bone. So we take blood from the waist bone and put it in the machine and get a aspirate concentrate. And that aspirate concentrate can make a layer whenever there is a damage or a defect in this cartilage area. So we inject over that area and put a material, that is a collagen material on that. So it will help, and leave it for at least 3-4 weeks, and we can see generation. If you go for again a arthroscopy visualization, then we can see there is regeneration of cartilage over the area. So it has been seen, it works very good in acute defects, and when the defect, cartilage defect is restricted to a small area. It has a drawback that a area of maximum of 2 into 2 centimeter area can be treated by this type of methods.
Okay. So for our viewers' sake, does this type of patients do need prolonged hospitalization, or it can be managed in a daycare basis? And any expenses, what is the around average cost like that?
So this is it is good that everyone should know that this PRP injection or BMAC injection, which are being used nowadays, and they are the mainstay of joint preservation surgery. So these are very cost effective. Means if you see the cost of the set which is used for a PRP injection, it costs around 15 to 20,000. So it is very cost effective as compared to a joint replacement surgery, and it can work wonders. So when a joint is injected with a PRP injection, patient can be discharged within 2-3 hours. So patient is usually observed, and as the material which is used is taken from the same patient, that is the patient's own blood or own bone marrow, so the chance of a reaction to the material is very minimal. Previously, when we were using hyaluronic acid or joint the viscosupplementation, which are also presently used by many, so these are materials which are artificial materials, like they are chemicals or artificial materials. So those also the cost is around 15-20,000, and there may be a chance of reaction if the patient is allergic to it. But in this case, there is very minimal chance or no chance at all for any type of reaction, because the material is from the own body itself. And the cost involved, as I told, the material is as such 15-20,000, and the daycare cost may be another 5-10,000, which and the injection cost, the procedure cost. So it's very cost effective as compared to a joint replacement at least.
So as we know that arthritis is a age-related disease, but we are coming across in the recent time that many young athlete persons, many young persons in their middle age group like 35, 40, 45, they are presenting with the arthritis. So, how do you see that knee preservation in this particular young adult or young persons?
So here we are discussing about the joint damage in a young patient. So joint damage in a young patient can be a disease process or can be a trauma induced. So first of all, disease process is a arthritis like a rheumatoid arthritis, psoriatic arthritis. In young patients also there may be knee damage. So in those cases, medicines are the mainstay, and whenever there is too much of damage, then we can think of joint preservation or joint replacement. But what we mean to say about the patients who are having post-traumatic, the young patients with post-traumatic damage, this may be due to repeated trauma by athletes, the patients who are in athletic procedures like athletic games like hockey, cricket, or athletes, they will have repeated trauma, and when they leave the game, say at the 40-45 years, they have severe joint damage and deformity. So in those cases, these are the cases, and also the mainly lady patients who have sedentary activities, they also develop early arthritis. So nowadays there are two extremes of patients in this category. One is who is highly active and who is sedentary. So if a sedentary person also develops joint damage, and a highly active person can also get joint damage. And because they are young, joint replacement, as we know, is a limited year surgery. Means after say 15-20 years we have to revise it. So in young patients it is more important that these patients should go for joint preservation surgery or joint preservation procedure per se. Initially we can go for medical therapy, physical therapy, injection therapy as PRP injection or BMAC injection, or if needed we can go for different autologous chondrocyte implantations, and different chondrocyte implantation procedures are also there.
Thank you, Dr. Padi, for these wonderful discussions. And we know that young persons are not immune to this arthritis. So we hope the younger arthritic patients should come forward for these knee preservation procedures rather than opting for a knee replacement which will disturb their later lifestyles. Thank you.
Thank you.